Excuse me. So thank you so much for having me here today. It really is a pleasure, and it's always a joy for me to see churches getting involved in this movement, because I really think we should be, as the church, on the forefront of the fight for life. So I want to start by asking you all a question. If I ask you to think of the pro-life movement, what comes to mind, or maybe who comes to mind? I'll give you a second to think about that. I think many people think of maybe activists holding signs, or maybe a politician on TV talking about the latest policy, or even a priest at the pulpit. But they don't often think of their OBGYN, or maybe their wife's OBGYN, or their daughter's OBGYN. And yet the physicians that I represent, nearly 7,500 now at the American Association of Pro-Life OBGYNs, play a singular role in the battle for life. We are the last line of defense. When laws and outreach and policies and everything else fails to save a child, we are there to pull up a chair and talk to the woman making the decision, the woman who finds herself in a very difficult situation. And our pro-life OBGYNs live by a very simple creed. When we enter a room with an expectant mother, we are responsible for the well-being of two patients, not just one. In fact, it's what makes my specialty, I think, the best one. And for us, this statement that we have two patients, not just one, is rooted neither in politics nor religion, though many of us are proud people of faith, but instead it's rooted in science. We know that 96% of human biologists agree that a new, distinct human life begins at the moment of fertilization. It's also rooted in medical ethics. The Hippocratic Oath 2,000 years ago, many of you have probably heard of it, prohibited the use of death as a therapeutic modality. And finally, it is rooted in common sense that pregnancy, shocker, is not a disease, and death is not healthcare. But today I will tell you, to be a pro-life OBGYN is not easy. It can be very lonely and even professionally dangerous. From the standard-setting bodies, to the board certifiers, to the medical schools, to the top academic journals, we are surrounded by those who believe not just that we are wrong, but that we should actually be barred from practicing medicine. And if you think it has gotten better since Dobbs, think again. But at Applog, we are more determined than ever. We will never relent in our defense of both our maternal and our fetal patients. We will always be their last line of defense. I want to tell you a story now. It's about a woman, Jessica, and her husband, who I had the privilege to meet. They were both overjoyed to discover that she was pregnant. They already had a son at home, but then had tried for over a year to get pregnant again and had finally gotten pregnant, and they were so excited about that. They excitedly went to her 20-week ultrasound, and many of you probably know that's a big day, right? Oftentimes that's when you find out what the baby is, and you find out that everything's okay with your baby. They found out it was a baby girl, but then that joy was shortly followed by some fear. There was a problem. You see, her daughter had a condition called anencephaly. And some of you might have heard of that. That's a condition where the baby's brain and skull don't fully develop. So her OBGYN, who she had known and seen previous to that, sat down with her and told her that her daughter would not survive for very long after birth, if she even survived the pregnancy at all. And of course, Jessica and her husband were understandably devastated, as any family would be, to hear this news. But unfortunately, it got even worse after that. Her OBGYN looked at her and told her flatly, you know, the compassionate thing to do is just to terminate your pregnancy. Without hesitation, Jessica said, I'm not interested in that. She was so upset with the response that she got from her doctor that she decided to go find another OB. Maybe that one would understand a little bit more what she was going through. So she and her husband went to a second doctor, who quickly told her the same thing. Your child is not going to live. you should just terminate your pregnancy. There's no point putting yourself through pregnancy and childbirth for this fetus with this abnormality. So she went to another OB and another and another. 6 different physicians told her the exact same thing. She knew that a C-section would offer the best chance to her daughter for a live birth, and Jessica desperately wanted to hold her daughter while she was alive before she passed away. But she had an OB tell her that a C-section would be a waste of resources since her baby was going to die anyways. Finally, they found a doctor who respected their decision. Jessica had her C-section, her daughter Mia was born, and she survived for 3 weeks, far longer than anyone had anticipated. They were able to take her home and have that precious time with her. And she told me that her son loved his little sister so much, and that he was going to be a better person one day because of knowing his sister. And she told me something else that I will never forget. She said, "The only thing my baby knew in her short life was love." What a wonderful thing for any of us to be able to say, that in our whole lives, the only thing that we knew was love. You know, if Jessica had followed her doctor's advice, her daughter would not have only known love her whole life. She would have known excruciating pain as her life was ended. The question I would pose to all of you is this: for those 6 physicians who no doubt cared for their patients and considered themselves pro-choice, where was the respect for Jessica's choice? And for patients not as determined as Jessica to get a second opinion, or maybe for a woman with an unplanned pregnancy who feels that she has no support from anyone, how much choice do they really have in a system that recommends abortion so eagerly and readily? Now, you might be wondering what APLOG advocates for in these circumstances. What does it look like to be a pro-life OB? And how would Jessica's story maybe have unfolded differently if she had seen a pro-life OBGYN right from the start? You know, I think many people think that the opposite of pressuring a patient to get an abortion is pressuring them not to get an abortion. But we don't pressure anybody. In truth, the opposite of pressuring a patient to get an abortion is actually just listening to them, discussing all of the options that are available to them. So in my day job, outside of this, I'm an OB hospitalist, which means I don't see patients in the office anymore. I just see them when they check into the hospital. And many times the women that I see are alone, they're frightened, and they're in a very vulnerable situation. And I know firsthand that in these circumstances, physicians can have an extraordinary amount of influence on the decisions that those women make. I also know that making them feel as if abortion is their only or their best option is not compassion, it's cruel. You know, I think many people are surprised when I tell them that the majority of women who came to me, especially when I was in office practice, thinking that they wanted an abortion, didn't actually end up getting one. And it's not because I have amazing powers of persuasion. It's not because I was pressuring them. I think that it's because these women were never actually certain in the first place. They came to me for my medical advice. They came to me to ask me questions, and they needed for me to engage with them in conversation, not just give them the number for the local abortion clinic. This is the nature of the physician-patient relationship. If a woman is certain she wants an abortion, chances are you're never going to see her. She's just going to go to the abortion facility. But when she comes to us, it's because she's looking for what we are supposed to provide: counsel, care, and compassion. And so oftentimes I would start this conversation by just sitting with her and saying, "Tell me what it is that makes you think that an abortion is the best option for you." That is the most revealing question, I have to tell you. Often I would hear, "Well, my family thinks I should," or "My family is saying that I have to," or "I can't afford a child right now," or "I'm trying to finish school." Sometimes they would say, "My boyfriend is making me." But whatever the case, again, it gives you insight into what they're dealing with and allows you to actually address the problem, not just recommend something that's not going to fix that problem. Next, my job as a physician is to help the patient understand all of the options available to her and the risks and benefits of each. This is called informed consent. All right, it's a core value of medical ethics, as I'm sure many of you are aware. It's like med school 101. I mean, we learned that very early on in our training. But for some reason, the medical establishment has decided that this principle of informed consent doesn't apply to induced abortion. The accepted norm now is you rubber stamp an abortion for every woman who wants one, with no real consultation whatsoever. Now, one of the obvious consequences of this, I think, is that many women and even the general public then assume that there's no real risk associated with induced abortion. The truth, meanwhile, is that there's not a single medical benefit to induced abortion, not even one, and there are significant potential risks. There's now more than 150 studies that show that women who have had past abortions, especially surgical abortions, have an increased risk of preterm birth in future pregnancies. I don't know if you all know this, but we have one of the worst preterm birth rates in this country of the developed world. And we are continuing to do induced abortions, which are worsening that. Numerous studies show that abortion can have devastating mental health consequences. I'm sure you all are very aware of this, including a 7 times increased risk of suicide. There's also increasing evidence of a link between induced abortion and breast cancer, particularly for women who have not yet had a child. So it is irresponsible and unethical for any physician not to warn a patient of the risks of any procedure, much less an elective procedure that ends the life of another human being. And so that's what I talk to my patients about. We talk about the risks of induced abortion. We talk about the risks of pregnancy. They're there, but we also speak about the benefits of pregnancy. I also make sure that they understand part of informed consent is they need to understand what it is that's growing inside of them. It's not just a clump of cells. Of course, we know science tells us this is a living human being, and I say, this is your child. This is not coercion, it's truth. And there really can be no informed consent without truth. But what about cases like Jessica's? We hear about those a lot, especially lately, right? What about when there's an adverse diagnosis for the baby, that maybe the baby's not gonna live as long as we would hope? Induced abortion is a legal option in many states, including many states that limit abortion for other reasons for women in these circumstances. But it is far from the best or only option for them, and here's why. One, did you all know that doctors are wrong sometimes? I know that's a shocker, you're right? But these diagnoses aren't always accurate. I mean, this is true in any branch of medicine, but it's especially important for these preborn children because they are the only patients on earth that I'm aware of who can be sentenced to death based on a single diagnosis. And sometimes that diagnosis isn't even right. Second, there's no consensus as to what constitutes a life-limiting diagnosis or a lethal diagnosis. I don't like that term, so I don't use it, but it's often used. Did you know there's no consensus as to what makes a diagnosis lethal or life-limiting? Some doctors will say that for a condition that has a 50% survival rate. Others for a condition that has a 5% survival rate. This is further proof of how much influence an individual physician can have over the choices that their patient makes. Now, of course, there are those instances, such as Jessica's, where the child is not going to survive for very long. We know this. In these cases, though, the issue is that that child is still a human being with value and worth. And I think most mothers, most parents feel this on an instinctual level. And in fact, the studies concur with that. Studies have found that families tend to do better from a mental health standpoint if they choose something called perinatal palliative care or perinatal hospice over abortion. So we at APLOG are big believers in compassionate options, truly compassionate options like perinatal palliative care. But again, we don't push patients into it. We simply make it clear that it's an option, and we discuss the benefits, we discuss the value of both of our patients, both mom and baby. So you may think, well, this all sounds very straightforward, right? We know what to do, so what's the problem? Why can't we just do it? Well, I'm gonna tell you what the problem is. The problem is not that some OBGYNs or some physicians or medical groups disagree with us on induced abortion. They are perfectly allowed to hold their views and conduct their medical practices as they wish within the bounds of the law. The problem is that increasingly, we are not afforded the same right. We are not afforded the right to hold our views and conduct our practices accordingly. And increasingly, they have the power to dictate what we can and cannot do because they've seized control of the medical institutions and the authoritative bodies, starting with the American College of OBGYNs, or ACOG. Some of you might have heard of them. They claim to be the standard-setting organization for the field of obstetrics. Whatever they say, I will tell you, is often seen as gospel truth by most practicing OBGYNs. That's how we were trained. They're also seen in the courts as the ultimate authority on women's reproductive health. Now, APLOG, the group that I represent, we originally were part of ACOG, actually. We were started as a special interest group within ACOG in 1973. That year might ring a bell to you all. The year that Roe was decided. And the reason we were started is because many of the members within ACOG saw that the leadership was becoming pro-abortion. And they filed pro-abortion amicus briefs in the Roe and Doe cases. And so they formed a pro-life special interest group, which quickly became their largest special interest group. And we used to be collegial. We worked alongside of each other respectfully, knowing that we disagreed, but we could work alongside of each other still to take care of our patients. But over time, as the generations have turned over, the leadership of ACOG has become increasingly radical on the issue of induced abortion. And about 11 years ago, ACOG instituted a policy to dissolve all special interest groups, including us. So we became our own organization, and we've more than tripled our membership since, so I think it was a good thing. But today, ACOG's reproductive health division is controlled by pro-abortion activists who are not objective. They are not evidence-based when it comes to this issue. And I think they are scientifically irresponsible in their approach to research. They deny the countervailing evidence. They refuse to engage in debate. They silence critics. They support zero restrictions of any kind on abortion, up to and even right after birth. They're out of step with even most pro-choice Americans and the more than 3/4 of OBGYNs who do not perform abortions. And yet they are seen as the standard-setting organization. Now, as many of you know, this capture of institutions by activists is a phenomenon across medicine. It's a phenomenon across our culture, right? And there are two key characteristics of these institutional captures. One is how activists wield power in the name of science to pass opinion off as fact. So ACOG calls it settled science that induced abortion causes no demonstrable harm to women. Never mind the hundreds of peer-reviewed studies that would state otherwise. The second is how then they accuse anyone who disagrees with them of spreading, you guys can guess it, misinformation or disinformation. Even though they continue to spout horrendous misinformation, including on the issue of abortion pills that they claim are as safe as Tylenol when we know they're 4 times more dangerous than surgical abortions. Again, ignoring the wealth of evidence that's out there. But by labeling the opposition not just wrong, but as liars working to deceive the public, they then get to excuse themselves from having to debate their ideas. Now, I think this is many things. I think it's deceptive, it's unethical, it's manipulative, but what bothers me most is how cowardly it is. They're afraid of losing the debate, and so they shut the debate down. And in fact, they have completely refused to engage in debate with us, despite invitations. And ACOG is just the tip of the spear, but it's hardly the full story of the institutional capture by pro-abortion activists. They have captured the medical schools, the major medical and academic journals, and perhaps scariest of all, our board certification body, which controls who gets certified as a practicing OBGYN and who doesn't. And what we're seeing today is only the opening salvo. I want you to think of me today as your Paul Revere. We're on the East Coast here, so I can say that, right? And let me tell you, the activists are coming. They are preparing a 3-part conquest of the women's reproductive health care system, and they are already 2 parts in. First, they are already utilizing the medical journals to control the scientific consensus. As many of you probably know, getting published in a major journal is how research and ideas get accepted as truth and then incorporated into medical practice. But on the issue of induced abortion, the premier journals have fallen in line behind ACOG. While they claim to be objective, they reject papers that even raise a question about induced abortion, much less cast it in a negative light. Good studies are getting excluded from publication, or if they happen to make it through and get published, they're later redacted at the first sign of outcry from activists. We work with a psychologist who has spent her entire life doing quality work on induced abortion's impact on mental health. She has been published in premier journals around the world. Now, her research is being redacted, not because it's been disproven, but because activists don't like her conclusions. And for any of you who might be in academics, you know for a researcher who has their studies redacted, that's, you're done. Your career is over. This undermines the entire scientific enterprise, which is based on the open competition of ideas. If we take this out of science, what you're left with isn't science at all. It's merely propaganda. Second, after they control what information gets approved, they then use that propaganda to indoctrinate the next generation of physicians in medical schools and residency programs. They have a couple of available approaches to them for this. One is to do what Canadian medical schools are already doing. You can just screen out applicants who are pro-life. That's the purest and simplest way to ensure ideological conformity. Thankfully, that's a little bit harder to do here in the US, thanks to laws that prevent religious discrimination, as well as provide conscience protections, many of which APLOG was actually played a crucial role in helping bring about in this country. So instead, they make the curriculums and the programs so hostile to pro-life students and so overwhelmingly biased that many who start out their medical training pro-life either feel forced to go along to get along, or they choose not to pursue the field of obstetrics at all. And that second one is actually a huge problem. I can't tell you how many students I talk to who say, I would have loved to go into OB, but I'm not, because I'm so worried I'm gonna be forced to participate in abortions. This has already begun here in the US. The body that accredits all medical training programs in the US previously, when I was in training, had an opt-in abortion training requirement. So it was not part of the standard curriculum. If you wanted abortion training, you could ask for it and you would be given access to it, but hardly anybody did, honestly. And that opt-in policy was in place for decades and it worked very well. But in 2018, they switched it to opt-out. One little tiny word that makes a huge difference. So now, this puts medical students and residents in an incredibly coercive environment. It teaches them that induced abortion is standard care. It's part of the job. They don't know that 93% of practicing OBGYNs don't do abortion because now it seems like it's standard. And I don't know if any of you in here know sort of the hierarchy of medical training, but you have medical student way down here, then intern, then resident, then fellow, then attending. So what this means is that that medical student all the way down here has to tell their attending that even though you want me to go in and do this, and even though this is standard training, I don't want to do it. So you tell me how many people are going to be bold enough to do that. And we've heard what happens to those who are bold enough to say that. They are forced to come up with their own curriculum, they're given the hardest shifts, they're mocked, or they're retaliated against professionally. And as a result, many medical trainees decide that it's simply not worth it, and they're pressured into submission. So that's step 2. Step 3 is what I believe is coming next. After the activists control the information and indoctrinate the next generation, then they're going to come for the board certification of anyone who dissents. This is the nuclear option. It is. It means completely destroying someone's career and their livelihood, but they will take it. They're already preparing, and they seized a major opportunity during COVID. So in 2021, the board certification body for our profession, called ABOG, issued a statement that if anyone was caught spreading mis or disinformation about COVID, their board certification could be brought under review. As soon as they did that, I looked at Donna, my colleague who Georgette was talking about, and I said, they're going to do this over abortion. We knew that they were laying the groundwork for that. So fast forward about a year, the Dobbs decision was issued in June of 2022. ABOG immediately sends out a statement decrying the decision and saying that induced abortion is essential health care and it should not be taken away. So we watched and we waited and we knew what was coming. Sure enough, 2 weeks later, they issued a statement revising their COVID mis or disinformation policy to include abortion or any other essential healthcare services. So we sent them a very strongly worded letter from our lawyer demanding clarification on what exactly constitutes a mis or disinformation and who is it that gets to decide that. We sent the letter to their CEO and to every single one of their board members. Crickets. They had already achieved what they wanted. Of course they weren't going to respond to us. They wanted to frighten into silence any dissenting viewpoints. At that time, we had 2 physicians working on op-eds about the Dobbs decision, about why it was a good decision for our patients, who backed down and said, I can't write this, because they didn't want to risk their board certification. And I can't blame them. They're the providers for their families. They had kids getting ready to go to college. That is how it starts. First, they intimidate you into silence. Then when you're weak and marginalized, they lower the boom. Now, they haven't yet come after a physician's board certification. They've only threatened it, but I think it's only a matter of time. And believe you me, when they do it, we will be ready to sue them to the moon and back. Because let's remember what the stakes are if they get their way. As the CEO of ACOG said recently in a Washington Post letter to the editor, abortion is safe. It improves and saves lives. And it must be available without restrictions, without limitations, and without barriers, just as any other critical part of healthcare. They support induced abortion for any reason, at any time, up to the moment of birth, and even after birth, in the event of a failed abortion when the baby is born alive. They oppose laws to prevent doctors from killing those children while they lie struggling for life on a table. That is what we're up against right now. But not to leave you on a bad note, let me tell you how we're fighting back. So first, we are drawing our line in the sand, and it has to be done. We've issued a Bill of Rights featuring 5 rights that ensure every medical professional can continue to provide excellent care to their patients. These are our battle lines. If we go down fighting, then we will go down fighting. But we are not going to back down in these areas. So first, we have the right to consider and act in the interest of all of our patients, including our preborn patients. This is quite simple. Again, science confirms that a new and distinct human life begins at fertilization, and so that human life is one of our patients. And the Hippocratic Oath instructs physicians not to harm their patients and not to use death as a form of treatment. And in fact, the original Hippocratic Oath expressly forbid abortion because it recognized it as a form of killing. Therefore, we have a right to practice Hippocratic medicine and consider the interests of all of our patients, including the preborn. That's right number 1. Second, we have the right to present information to our patients about the risks and alternatives to any procedure or treatment. And this means that we apply to induced abortion the same ethic that physicians apply to every other procedure. Patients have a right to consent to or decline any treatment, and they should do that based on accurate information. Third, we have the right to abstain from acts that violate our conscience, and this includes performing or referring patients for induced abortions. Fourth, we have the right to access and act upon information that is trustworthy, transparent, and unbiased. Physicians need to know that when they're reading a medical journal, that the information that they're reading is reliable and can be used as a basis for their practice, and know that it's not being motivated by a political agenda. And fifth, we have the right to organize with like-minded colleagues without fear of retaliation. We talk to OBGYNs all the time who say, I love what you guys are doing, but I can't be a part of it. I have a mortgage and a family to feed. And so we are fighting for their rights to continue to practice life-affirming medicine and to be a part of an organization like ours. So what is APLOG doing in defense of them? Well, again, we serve as a membership organization. We provide resources, information, and networking for our members, along with encouragement. And I would encourage you all, if you have a pro-life physician, to encourage them every time you see them. It's hard and it's lonely right now. Second, we serve as a second medical opinion to the legislators and the courts. They need to hear that induced abortion is harmful for women. We are not benefiting women in any way by continuing this practice. And third, we educate policymakers, medical professionals, and the public to help them have an evidence-based rationale for their defense of life. You know, a moment ago, I told you the dark vision of the activists, a future where pro-life physicians are no longer certified to practice medicine. If that's the dark future we hope to avoid, what is the bright future we hope to bring about? You know, there are many people that think that we're headed towards parallel health systems, one that respects life and one that doesn't. You know, to me, I think pro-life physicians, though, need to be in the system in order to have the biggest impact. We need to be in the room with undecided women who aren't sure whether or not they can go through pregnancy to tell them, yes, you can. And we can help you by ensuring you have the resources, the support, and the information that you need. But in order to do this, we need to get the medical profession to again allow open discourse and debate so that we can agree to work alongside of each other to take care of our patients, even if we don't fully agree on these issues. And APLOG wants to be the medical organization that brings us back together. Again, if not into complete agreement, at least so that we're able to gather around the same table and talk and collaborate on research. To preserve our role as that last line of defense, that's what we need to get back to. I want to close with a story. You know, I mentioned earlier that I'm an OB hospitalist, and thankfully, most times my job is very, very happy. I love getting to be there as parents welcome their child into the world for the first time. But sometimes it's really sad, too. And when it's sad, it's really sad and really hard. But to me, it's just as much of a privilege to be with families in those really hard situations as it is to be with them in those really joyous situations. I recently had a patient and her husband come in who I remembered from their last delivery. Their previous child ended up being an emergency C-section at 24 weeks. That baby thankfully survived, but it was a very traumatic delivery for both mom and dad. Things had to move very fast. We had to get mom to the operating room very quickly, and the dad had been left feeling obviously scared and kind of neglected in the whole situation. Unfortunately, this recent visit that I saw them for was for complications she was having with the second baby. She had had a stitch placed in her cervix called a cerclage that's meant to hold the baby in and prevent her from losing the baby. When she came in, she was about 20 weeks, and she was bleeding, and bleeding that was getting significantly worse. It was a very difficult situation because I had to figure out whether or not we leave the stitch in or do we take it out, knowing almost certainly that as soon as we take it out, she's probably going to lose that baby. And her baby at 20 weeks was just below that cusp of viability, of being able to survive outside of mom, but only weighing about 10 ounces. When I had taken over that morning, my off-going partner had given me a heads up that the husband was very upset and had been kind of verbally aggressive with the physician and the nurses overnight. So when I went in, I was kind of, prepared for that, but I immediately recognized him from the time that they had been there the last time. So after some time talking with him, I came to understand that he had PTSD, really, from that earlier delivery. And I knew that his current behavior was coming from a place of love and concern for his wife and their baby, and frankly, fear of what might happen. So I sat on the edge of their bed and talked to his wife and to him for a really long time and explained that we were indeed in a very tough situation. It had become obvious at that point that we were not going to be able to stop the bleeding, and we were going to have to go ahead and cut that stitch. I talked to them about their baby, not saying the fetus, but saying your baby, your child, your daughter. I told them that my priority was ensuring that they would have as much time as possible with her. And in the end, he looked at me very calmly and said, I think that makes total sense. All he needed to know was that I saw the value in his daughter's life, even though I knew we were going to lose her and there wasn't anything that I could do about that. Their baby ended up living for 2 hours, and they got to hold her and have that time with her. And I saw them after she had passed away, and the mom, my patient, told me that she'd had a hard time holding her because it was just very emotional for her, but that she sang to her as her husband held her. I could tell she was really struggling with the fact that she hadn't been able to hold her daughter very much. And so I took that opportunity to tell her what Jessica had told me. I said that in delivering her baby and singing to her, the only thing her baby knew in her entire life was love. You know, today, so few OBs, even though they've had experiences like this, choose to advocate publicly for life. Many argue that it is not compassionate to have a woman stay pregnant when she knows her baby is going to die. Many even tell the mother in her most vulnerable hour that it would be cruel to stay pregnant, that maybe her child will suffer. But in fact, we know that a child does not suffer in utero, and with proper care, they don't need to suffer after birth as well. But if they're torn apart through an abortion procedure, we know they suffer. You know, despite my strong beliefs on this issue, I don't demonize physicians who counsel in favor of induced abortion. I really do think that they have been brainwashed, and they think that they're doing what's best for their patients. I do have a bigger problem, though, with those who know better and do nothing. You know, throughout history, I think those are the contemptible characters, the ones who knew something bad was going on, but stayed quiet and took the path of least resistance. Upon being interviewed years later, many good and decent Germans who were alive when their Jewish neighbors were being rounded up and sent to die rationalized their lack of action by saying, "But I'm only one person. How was I to make a difference?" They didn't realize that millions of others were having the exact same thought, and together they could have made a difference. And so many physicians today feel that they're the only one who's pro-life. But we must not let the same be said of us. We must come together. We need to organize. We need to speak up. We need to encourage our physicians to practice according to sound medical ethics, even when it's hard. No, especially when it's hard, especially when it feels lonely or professionally dangerous. If ever there was a goal worthy of struggle and sacrifice, it is this. Because only by speaking up and acting according to our conscience can our friends and allies find us, be inspired by our courage, and stand beside us. Only by standing up for what we believe in can we help our pro-choice colleagues, our pro-choice friends, our pro-choice family members see that the preborn have been forgotten, and as a result, our maternal patients have been too. And that's what AppLog is here for, to inspire pro-life physicians, to inspire you, hopefully, to encourage your pro-life physicians, to organize on behalf of them, to expand our ranks, and to care for both of our patients, as well as to stand strong as their last line of defense. Thank you. Oh, this is Q&A? Okay. I think there's time for questions.
We're going to do some Q&A with Dr. Christina. Thank you so much. That was very helpful. And I want to start by asking a question as we get some folks that you can come to the microphones to ask questions, and you can also use the virtual 412-515-0293. I've got my iPad with me. But this, I think, is probably a question that's on all of our hearts and minds.
Yeah.
As a Christian woman looking for a new OBGYN, what kind of questions should we be asking a doctor to help us identify where they stand without putting them on the spot?
Sure, I think that's a great question. And before I give my full answer to the question, I'll take a chance to plug our website a little bit. On our website, which is just aaplog.org, we actually have a public directory. So if you are in a place where you want to know if one of our members is practicing in your area, you can look it up on the website. So that's an easy way to know that you're getting a pro-life physician. But I will tell you that they have to opt in to being listed. And because of all of these things that I've just told you about, if you live in an area that's pretty hostile towards pro-life beliefs, chances are we probably have members in your area, but there may not be very many that are listed because of the fear of being fired or losing their positions if they publicly identify as pro-life. So I always have to preface by that. But right, so what if you're in one of those areas where you can't find somebody on our directory and you're going to a new physician and you want to find out? You know, one thing is it would be very easy to just ask the hospital, just the hospital system where your doctor is practicing, if they do induced abortions. And then that might give you some sense of whether or not there's a chance that your doctor is going to do them or not. We know, again, like I said, that 93% of OBGYNs don't do abortions. That doesn't mean that 93% of OBs are pro-life, unfortunately. I wish that was the case. But for some reason, they choose not to do them, you know, even if they're pro-choice. So another thing might be to ask, especially if you're seeing them either because you are pregnant or you are thinking you might become pregnant, is what in general is your advice to a patient who's facing either an adverse prenatal diagnosis or a pregnancy complication? What would happen in that situation? That could get you a sense. Or, you know, how many women do you see or girls do you see in your practice who have unplanned pregnancies? And they would probably tell you, and then you could say, you know, what is your advice that you give them? And maybe it would be something as easy as saying, I have a daughter right now with an unplanned pregnancy, or I have a friend whose daughter has an unplanned pregnancy. What would be the advice you would give them? And I think their answer to you in that would be very telling. The other thing is if you see that there's a pregnancy center in your area who has a medical director, good chance that that medical director is pro-life, so that's always good. We always like to feed business their way. So that's kind of how I would start. I mean, you can come right out and ask them too. I don't know many physicians that are going to be offended by that, honestly. So if you wanted to just come right out and say, do you do abortions? Nobody's going to be offended by that. But if you're not quite wanting to be that bold, then you could ask some of those other things. Yeah.
All right, let's go over here. And yeah, we're just going to have you stand, yeah, right there. That's perfect. Because the cameras are capturing you for the virtual audience. We didn't know that at the beginning of the morning.
That part. You mentioned encouraging your pro-life doctors. What does that look like in a practical way? How can we do that?
Yeah, great question. So I think just if you know that they're pro-life, the next time that you go to your visit, you could even just use this talk as an opportunity. And you could say, you know, I just recently heard an OBGYN talk, and she told me how hard it is for y'all right now. So I just want you to know I'm so thankful that you're pro-life. Please stick to those convictions. I'm so thankful to have a pro-life doctor taking care of me. I think even just something as simple as that. The other thing, though, that you can do is if you know of ways, maybe you work with a pregnancy center, and you know you could bring that up to that physician and say, you know, we're so thankful to have a pro-life physician in our area. Would you ever consider working with us on this, or even just coming and encouraging our staff? I think being asked to do that and it being acknowledged that their pro-life beliefs and their pro-life practice is a good thing and something that's desirable. The other thing I will tell you that I think is marvelous is refer your friends, your family, and when they go, have them tell that physician that the reason they came was because they were pro-life. I think many physicians think that that's actually going to hurt their practice if that gets out, but I try to tell them all the time because it is the most common call that we get at Applog. It's the most frequently visited part of our website is that public directory. So I try to tell physicians all the time, it'll actually be a huge boom to your practice if you let people know that you're pro-life, because there are so many people looking for that. So I would encourage them through that. The other thing is be aware of what your state, are most of you local? Or, yeah, okay. Yeah. Be aware of what your state and local laws are. So if you're not from around here, be aware of what your state conscience protections are like. So not to get off on a tangent, but right now, federally, we do have conscience protections, but our only mechanism of enforcement is through HHS. So you can imagine with our current HHS how likely they are to enforce conscience protections. Not likely at all. So physicians actually don't have a private right of action. So if I get fired because I won't do an abortion, I don't have the right to sue on my own behalf. HHS actually has to defend me. And so one of the big things that we would like to see happen is and there are some states that have passed this, that passed a bill that gives a private right of action to physicians. I think that's very important. So even getting involved, I mean, I think sometimes when legislators hear from physicians, they see it as, you know, we're motivated by our own interests, but for them to hear from patients, this is why I want a doctor who practices according to their conscience. That's very important too, and that's another way I think that you can encourage pro-life medical professionals in your realm.
Thank you. Yeah. All right, we have a young man over here.
Yes. You said that if the abortion industry makes it so that pro-life physicians lose their medical licenses, you will sue them to the moon. What will you do if those lawsuits fail?
That's a very good question. So I do actually think that those lawsuits would succeed, especially if we can get a favorable HHS back in place, because we actually do have relatively robust conscience protections, which is why I think they haven't gone after anybody's board certification, because honestly, if they were going to, they probably would have gone after mine at this point. So I think they know they don't have a legal leg to stand on. But what it's going to take, but that's a very good question, because we are already preparing. APLOG was one of 5 founding organizations of the Alliance for Hippocratic Medicine. Many of you might have heard of AHM recently, because they, along with APLOG, are plaintiffs on the lawsuit against the FDA over the abortion pill that's going to the Supreme Court now. So, but we put together AHM because one of the reasons was we anticipated that we could get to a system where they can actually just say, we're not granting you your board certification. And so, you know, we may get to the point where we have to develop an alternate plan of certification. So that board certification entity is actually, there's no reason that they have to be the only board certification game in town. In fact, there is another one that has started up in the last few years that so far seems to be friendly to pro-life physicians. So if a lawsuit would fail, then what we'll be looking at, like I said, is like parallel healthcare systems, essentially, and parallel certification systems. So hopefully we don't get to that. That's
all right. Thank you, dear. We have a question online. Does the APLOG website have links to the papers you referred to? For example, the prevalence of suicide being 7 times higher among those who have had induced abortion. And then I have a follow-up question for that one.
Yes. Wonderful question, and thank you for the setup. So yes, if you go to the website and click on the resources tab, the website is meant to be a resource for medical professionals, but I will tell you that I think a lot of our resources are very accessible for someone who's not medical as well. So if you look at, we have practice guidelines, committee opinions, all of them are fully sourced. So you can read through the document, and then all of the sources are cited at the end so that you can find the original study that we're quoting in the document.
And are a lot of those done by Priscilla Coleman?
Yes, our ones on mental health. And Priscilla is actually the psychologist that I was referring to, who's having her research redacted. So, so I know that you all are a praying bunch, because I was prayed over wonderfully out there. So actually, since you brought her up, I would ask for prayers for Priscilla. She is a world-renowned researcher who really has devoted her entire life into getting the truth out there about what induced abortion is doing to women. And she is facing, I mean, I can't even imagine going through the attacks that she is facing, and her research getting redacted for no reason. Research that's been published for 20 years in some cases that's now being looked at, and they're trying to redact it. So please keep her in your prayers.
Yeah, I had a chance
work.
to speak with her recently, and we have used her research with Silent No More, so she is a very special woman for all of us, so please pray for Priscilla. Separately, is there ever an option for medical students to be trained only in non-elective abortions, such as ectopic pregnancy or retained miscarriage?
Yeah, absolutely. What a great question, because one of the big things of misinformation since Dobbs is now if a state like mine of Indiana now has these pro-life protections and is restricting abortion, now all these doctors all of a sudden aren't going to be trained in how to take care of women in other situations like miscarriage and ectopic. This is so ridiculous. It's so ridiculous. It makes me so angry. So I'm not Catholic, but I trained at a Catholic hospital. We did not do induced abortions. I could have left my residency training program on the day I graduated and gone across town to Planned Parenthood and gotten a job doing abortions if I had wanted to. I had all the technical training I would have needed to do abortions in a regular OB residency with no abortion training, because you learn how to do, for the most part, other than like 3rd trimester elective abortions, you learn how to do everything else. We learn how to do DNCs, but for the purpose of treating miscarriage, not for the purpose of ending a life. You learn how to treat ectopic pregnancies. Every single OB resident who does a 4-year OB residency is taught how to do those things, even without abortion training. This has been the case since the advent of our profession. And so this new lie, again, it's a scare tactic to get people to support something that they otherwise wouldn't support. So that's a great question. First of all, we learn all the techniques we need to learn, but second of all, I think it's really important to talk about intent. And of course, the intent of those procedures, the intent of treating an ectopic pregnancy is not to end the life of that preborn child. The intent is to save the life of the mother. So those are two very different things.
All right. Okay, Jean, you've got a question? Oh, there we go. Yep, it's on
Hello?
now.
Do you have a prediction about the Supreme Court case related to the chemical abortion pill? I think you might be a part of that.
Yes.
And, trying to reinstate some of the safeguards, at least.
Yeah, so just to give you a very quick overview of the case, or what the Supreme Court is hearing, and yes, I am, through AppLog, one of the plaintiffs in the case, and so my very wonderful lawyers would probably kill me if I tried to prognosticate of what's going to happen. But I think if you look at what the lower courts have done, the lower courts have agreed with us. They've agreed with our complaint. So I'm hopeful that the Supreme Court will as well. What the Supreme Court specifically is going to hear this spring is our challenge to changes that the FDA made to the safety regulations, as you referenced, that were put into place around this drug. So when the drug mifepristone, the abortion pill, was approved, it had a black box warning, essentially, that was placed on it because of the severe adverse effects, and it had all of these safety regulations to regulate how it was dispensed to minimize the risk to women and girls. What they did in 2016 was they made several major changes. They expanded the time in pregnancy you could use it. They said that women didn't have to have follow-up visits. They only needed to be seen once. They said that non-physicians could prescribe, and then they did all of that. And then they said, oh yeah, and you don't have to report any complications to us other than if a woman dies. Then in 2021, they took away that in-person dispensing requirement. So they took away the one remaining visit that was left. So now these pills can be obtained online and sent through the mail with no medical supervision. And part of the evidence that they based it on was like, well, look at the last few years. We expanded all of this, and look, there was no increase in complications. Yeah, because you stopped requiring that they be reported. So the Fifth Circuit agreed with us on that, and that's what's then been appealed to the Supreme Court. So I am optimistic because all of the lower courts have agreed with us so far. I think it's a very reasonable thing that we're asking. The Supreme Court is not considering taking this drug off of the market. That was part of our original complaint, but that's not what the Supreme Court is considering right now. They are just considering whether or not we put back into place these original safeguards that would mean that women have to be seen by a physician before they take these drugs. They have to be screened for ectopic pregnancy before they take these drugs. Very common sense things. And honestly, this is something that people on both sides of this issue, of the issue of abortion, should be in agreement about. This is medical malpractice for women in this country, and they deserve better. And so I'm optimistic. Please be in prayer for our legal team at Alliance Defending Freedom, who's doing amazing work on this case. So
thanks. Yeah. Question over there?
Yes, ma'am. Are there any medical schools that are more friendly to pro-life students and pro-life causes?
Yeah, great question. There are actually. So there are some that are specifically pro-life, actually. So Liberty University, which is close to here, has a medical school. In fact, several of their students are coming to our national conference in about a month on scholarship, so we're very excited about that. Let's see, who else? Creighton has a medical school, so they are obviously very pro-life. And there's a few more. I think there's a Benedictine college that may be working on a medical school. So there are some that are explicitly pro-life, but then there are definitely others that, while they may not be explicitly pro-life, they are not going to pressure you as a student to get involved in abortions. If you say you don't want to do it, they're going to be fine with that, and they're not going to put any pressure. So one of the things that we do by partnering with another organization is helping people who are looking at going to medical school or people who are looking at going into residency to kind of help direct them to programs that are going to be a little bit more friendly. And there are some that are definitely not friendly whatsoever. So yeah, but there are some, thankfully. So yeah.
Well, all right. Thank you for a wonderful afternoon of education and information. And let us thank Dr. Christina. Thank you.